This meeting is being recorded.
So, welcome to this first episode, the first one in Portugal about patient. This organization and this webinar is organized between Portuguese Society of Health and Malta Health Network. Congratulations, Gertrude, and thank you for this association. My name is Cristina Vaz de Almeida. I'm the president of Portuguese Society of Health Literacy, and we have today a group of experts on several areas of patient and patient teacher. We know that the current social and political context is favorable to patient involvement at different levels of the health system. The integrations of patients in teaching raises questions, in particular about the acceptability of them by participants, the profile of the chosen teacher patient, and the specific contributions requested from patients. Support for change from students, physicians, and teacher patients, we must consider it. So the literature analysis finds works on these subjects, focusing on the point of view of students and teacher patients. And the perspectives of the physicians in relation to patient partners are generally poorly documented so far. So this involvement can take multiple forms, such as information, participation, collaboration, partnership, delegation to share decision-making and control. But we know that this knowledge can lead to different levels of participation in teaching, witnessing, to co-construction. So the role of the patient teachers is encouraged in care, in health education, research, and in health system organizations. At the organizational level, the participations of patient teachers and their representatives, members of patient associations, and various use partner figures in the work marks a turning point in institutional recognition. We have in this panel real patient teachers and representative for several patient associations and patient advocacy. Gertrude Buttigieg is the main organization with Portuguese Society of Health Literacy, and she's the president of Malta Health Network. Dr. Gertrude is a patient advocate. By profession, is licensed in speech language pathologist, and she has 2 masters in International Patient Advocacy Management at Catholic University of the Sacred Heart and the master degree in health management offered by the University of Malta. On a full-time basis, she works for the Office for the Commissioner of Rights of Persons with Mental Disorders. On a voluntary basis, she serves as the chairperson of the Malta Health Network, which is an umbrella organization which brings together over more than 40 health-related organizations. Gertrude has participated as speaker and participant in several conferences in Malta and abroad. She has served on the Malta Council for the Voluntary Sector since 2013, and since March 2023, she holds the role of chairperson. Thank you very much, Gertrude, for being here, for being a good partner. Is your step and your words that we count right now. Thank you.
Thank you, Professor Cristina, for this opportunity. You are really the person behind this interesting webinar. And I must start by thanking Dr. Maria Teresa Flor de Lima She's a pain specialist, but she's also an old friend of the Malta Health Network. One of the areas we have worked a lot in is chronic pain. And obviously, Professor Dr. Teresa is really an advocate in this area. So it was thanks to her that we made the acquaintance with your organization for Health Literacy Society. Taking this subject of the patient teacher is very interesting for us. It is something which is new, as you also explained, that this is taking a different level, following the work which has been done in the past years on patients' rights, patient empowerment, patient advocacy, self-management. These are all areas which we have promoted in Malta and with our different groups. Also, the area which you promote, health literacy, we believe that it is very, very important for patients, for professionals, and for a successful health system. And so it was very interesting. And when I proposed to the board holding this joint webinar on the patient teacher with your organization, it was a big yes. And I won't take a lot more time because I look forward to hear what the speakers have to share about their experience as patient teacher. And I just want to end by thanking the audience who are with us this evening. And I hope that they will also join by sharing their experiences or their questions.
Thank you very much. Thank you, Gertrude. I will summarize now the curricula of each speaker because I think it will be very interesting. And thank you to Dr. Maria Teresa Flor de Lima for all you have done in Portuguese Society of Health Literacy in the area of pain. Dr. Maria Teresa, she's the Vice President of the Chronic Patients Association, member of Pain Alliance Europe. She's founder of National Platform SIP Portugal, and member of Executive Committee. She's member of YES and a member of Portuguese Society of Health Literacy. Member also of the European Parliament Group on Patients' Rights. Concerning now about the profile of Alexandre Guedes. Alexandre Guedes is da Silva, 60 years old, naval architect and ocean engineer. He was an amateur adventure racer when he discovered at 45 that he had multiple sclerosis. From then on, in the person, he says that I use most of the sports and survival skills I learned to fight the physical and mental degradation imposed by the normal course of the disease. Today, I feel that I'm an expert of my multiple sclerosis, and I feel that I have significant knowledge and control. Most of my professional career was at university faculty member. Thus, for me, this is natural to present it as patient teacher. Thank you, Alexandre, for this so nice short presentation. And Vivian Cassar, Secretary of Europa Donna, Malta, member of Malta Health Network, patient advocate, retired school counselor, and adult educator. After the diagnosis of metastatic breast cancer, she attended conference to become a patient advocate, gives talks on radio and to groups on well-being and positivity, attends local conference and webinars to support policies and service innovations, still receiving immunotherapy every 3 weeks. It gives her the opportunity to monitor patient experience at hospital. She writes articles for newspaper and community magazines. Thank you, Vivian, for your presence. And then Carmen Monge Storytelling Bootcamp. She's a researcher and cancer advocate, affiliated with MANO Behind Cancer and Youth Cancer Europe. After a cancer diagnosis, Carmen has lived in 7 countries across 3 continents, bringing an international perspective on survivorship, healthcare systems, and cancer across cultures. She's the author of Can Series, a children's book collection designed to help young readers and families understanding the holistic cancer journey grounded in both lived experience and research. As a research and international speaker, she focused on the equity, diversity, and inclusion in cancer care in Europe and serves as an active ambassador for initiatives such as the European Network of Young Cancer Survivors. And Tamara Millar, at least one of the most important patient associations and women in patient organization, cancer. Tamara Millar, she's the president of Evita Association, Hereditary Cancer, member of the European Patient Advocate Council at European Reference Network Genturish, Genetic Tumor Risk Syndromes, member of the National Cancer Hub Portugal, trained patient expert by European Patients Academy on therapeutic innovation, empathy, and she is an invited lecturer at Faculty of Research and Science, University of Lisbon. So this is a very good panel. I will start for the end for Tamara, and I would like to make a round between you that the question is, what kind of value added the patients could bring to the science and academy? Tamara.
Yeah, thank you for the question. I think, first of all, the patients have the most holistic approach regarding their disease area. We are the only stakeholder that are in contact with all the other stakeholders. So we have a truly holistic approach on our disease area. And so we can bring in different perspectives as well as our personal experience with the disease. And I think it's very important for future doctors to have close contact to their future patients and understand why their work is so important and why it's so important to focus on the real needs of their patients. I think it's not fruitful to have theoretical, only scientific approach to patients. It's individual that needs to be approached in a holistic way. Again, holistic approach is the topic I really would like to underline in this discussion, because every doctor has his own specialty. So we have the general practitioner that is supposed to know everything about every disease, which is impossible, of course. Then we have the specialists that are very focused on their specialty. If we look at hereditary cancer syndromes, for example, if you have a genetic variant, pathogenic variant in a gene, you have a group of organs at risk. So you have a lot of specialties involved in this topic, as well as other medical science like psychology, like sociology, like communication skills are also very important for doctors, for the doctor-patient relationship that is very important. I think it's very important to think about this patient-teacher approach in the sense of a mind shift, because I understand that the academic is open to involve patients in their teaching. They just don't know how to approach whom at which point and how to select those patient teachers, because everybody has different characteristics. So it may be a language barrier, it may be a very specific disease. If you approach, for example, psychiatric pathologies, that may be more difficult to involve patient teachers in this in the classroom.
Thank
So,
you, thank you, Tamara, because it's quite important. And I will pass to Alexandre. Alexandre, do you agree this vision, individual and holistic, that Tamara speaks, tells us?
Yes, I think we need to see the full picture. Otherwise, we are blind in our action. And because of that, I believe that from a societal point of view, is important that we act in order to be able to convey a positive message to the people, not just complain, but also being capable of give good proposals on the table and discuss them in order to create value to the society. And I think also that in our relation with the different stakeholders, namely science and the academy, it's important that they hear what we have to say, because otherwise you don't have the full experience of the people with the disease. So you cannot really understand what are our expectations toward our health. And because of that, I think our role is a central role in order to design research projects and initiatives. We also have an important role regarding to science. Is in a way we act as pollinizers of knowledge. So all our associations create community groups of people with the same disease and families of those people, and we act as conveyors of the new knowledge, of the new ideas, and we also are able to give to the academics and to the researchers the feedback of the expectations of all our communities. So I think this role is quite important, and that's why it's very important to hear the patient advocates and the patient teachers.
Patient teachers. Thank you, Alexandre. So Gertrude, the pollinizers of knowledge, quite interesting that Alexandre says. What do you think about the profile and what patients could bring to this science and academy?
I think the patients bring the added value, because we all agree that the professionals have the knowledge, they get the teachings, they get the scientific background, they get the research. But then there is the human aspect, which sometimes it is missing in the academia, in the school, and universities, when the professionals are receiving their training. And listening to the patients and getting the experience the patients have throughout their journey, from diagnosis, treatment, rehabilitation, living a life with a condition, with a chronic condition, dealing with family demands, going to work. I think these are the aspects which the health professionals need to be made aware of in order to the patient to have a full life despite of living with a disease, with a condition, be it temporary or be it something which is more chronic.
This is quite important, the human aspect of the profile of patient teacher, the human, and I will direct the question to Dr. Maria Teresa Flor de Lima, because she works a lot in pain, and in pain is well associated with all the humanized and the human aspects. But Dr. Teresa, please, the stairs is yours.
Hello, everybody. Hello, Gertrude. I like to see you here. I think it's the first webinar in this topic. I hope this is not the only one. We must go on. I'm trying to be practical, to talk about what I learned with patients in my professional career. Because I understand soon that we have to know pain, we have to know the impact of pain, we have to know how to communicate well with patients, and we have to know well the person we have in front of us. This goes with what I've mentioned before, some of you, because of we have to know the person, the reality of their life, the emotional reactions, and what change they have in life because of pain. Another side is the psychological reactions in terms of expectations and in terms of beliefs of this person. I don't want to talk only about pain, but it's today in all over the world we learn that it's a multidimensional approach, and the self-management are two important topics. So what can we which goes from the patient as teachers? We can compare some examples, some peoples, and I agree that the group of patients with some pathology is very important for them to understand the problems of each other. We can compare policies from different countries if we make a networking with other countries. We can listen, experience, and learning from the patients themselves to understand the needs. It's very important to decide the policy, to help better attention, better education of professionals, of the patient and of the society, that is literacy. We need to empower patients. We need to stimulate research with patients, advocacy, humanism, and volunteering. What we can get with this, also better management of research, reduction of costs, and joint debates with patients, students, professionals, and politicians. I think it's very important to join different kinds of people.
Yes, thank you, Dr. Maria Teresa. Thank you. And to Vivian Cassar, because Vivian is a well-known patient advocate. And in your perspective, Vivian, what about the value added that Gertrude talked about science and academy?
Yes, Así que tienen que revisar sí o sí.
Vivian? I'm sorry.
Yes.
Yes.
Is okay? Okay. No, I think the an important factor that I see in this regard is, you see, the clinical aspect the professionals know or they're being trained in, you know, but there is the quality of life of someone who's going through illness and all that is, it's a great impact on the person when you have a chronic illness. And I think one of the aspects is that we have to go through the whole journey. You know, sometimes you might get at the diagnostic stage where people think, oh yes, they need help, etc. But then there's after diagnosis, living through even survivorship. Afterwards, I think we still need to give the feedback on that, giving our input. To professionals, because sometimes, and it needs to be emphasized, obviously, the health aspect, but patients don't only have the health aspect to deal with, they have financial situations, they have, as Gertrude was saying as well, work to deal with. So there are other issues that perhaps professionals do not realize, that the patient is being impacted from many areas. There's the health area, there's the social area. So I think it's very important that they do get this. I had an experience, I think through the Malta Health Network, where I was invited, and other groups were invited, but my input to nursing students, BSc nursing. And it was quite a wonderful experience for me. And even after I gave my presentation about my role as a survivor, etc. I had many of them come up after the thing to speak to me on a personal level. So there is interest, and I think through the Malta Health Network, at least in the nursing. BSc nursing, the coordinator is aware how important it is for feedback from patients to the professionals. I think that's one thing. And I think there's a more important aspect of as well, because when we mention certain things, it's a good source of data collection, so that more research can be done on that particular aspect. Because I don't know, maybe if I had a side effect, which was not a common side effect, the professionals would be listening, hopefully, and say, oh yes, we must look into this aspect more thoroughly. Perhaps I think that's one of the things. So, and as I said, there is a very important factor for me anyway. It's the feel good factor. What makes patients feel good? And I think professionals need to hear this, because, as I said, the clinical aspects in general, I think many of my patients, my friends and in these areas who are going through it and going, we tend to be very, we know the clinical aspects are very well taken care of in general, all right? I mean, there might be one or two alternates, but I think the aspects of the quality of life need to be understood. So that's my
interesting. Yes, the feel-good factor, indeed. And finally, to Carmen Monge.
Christina, can you remove the slide so we can see the speakers, please? Christina.
Gertrude, yes?
Can you remove the slide so we can see the speakers?
Okay, of course. So, well, I think we are, okay, everybody's seeing each other. So let me, before I give the word to Ruth, let me just hear Carmen, because Carmen is a youth cancer representative, and she's doing a very good work for Academy also. So for patient teacher, because our main goal is to talk about patient teacher. Carmen, what do you think about and the results?
Well, thank you, Christina. And I think like most of the people said everything that I wanted to say, so I'm going to be short. Well, definitely patients can bring the human side of the history. I am a researcher. I'm also a patient advocate, and I know that as a researcher, sometimes you just see numbers, right? Because it's the easy way to analyze information. But as a patient teacher and a patient advocate, actually you can do research more person-centered, not too much illness-centered. That is right now what is being done in many universities and hospitals, right? And also, as many of you said, gives a more holistic approach in the sense that the patient has an illness and everything, but there is a lot of things behind this. This could be work, this could be career, this could be relationships. So there are a lot of things that the researcher has taken into account. And lastly, with my international experience, I have seen that an illness is different in every country because there is different stigma, accessibility, even like the patient priorities are very different depending on the country. So a patient teacher, if the patient teacher are diverse, they could bring a whole different scenario to the research if they come from different part of the world or if they come from underserved or underrepresented communities, as there is the LGBT community or the low socioeconomic status or people with different disabilities.
Yes.
So, yeah.
Yes, correct, Carmen. Yeah, you point directly. So we will give the word to Ruth Guillaumier. Guillaumier. Please, Ruth. Welcome.
Good evening. Hello, everybody. Ruth Gulleimer from Malta. I'm part of Action for Breast Cancer Foundation in Malta, but we're also part of the Malta Health Network. And this discussion brought to mind some points that the Malta Health Network did discuss through that project of to be seen and to be heard. They did publish a booklet, and I went through the booklet very well. And I can tell you that although there is this well-known idea that clinicians or surgeons are just there to actually deal with the medical aspect of cancer or whatever disease it is. It also depends on how the patient approaches the medical professional and be open enough to actually bring up certain psychological issues. I can tell you from my own direct experience that if you actually break the barrier, overcome the barrier, and actually discuss the psychological issues, they do actually listen. So it's a case of the medical professional would want to listen to the patient actively, and the patient is open enough to actually bridge the gap between the patient and the medical professional. I can tell you that it works because I did do it for my own self. When I go for consultations, I do discuss certain things. And they do listen, and they do try to help out even in a psychological fashion. So yes, it all depends. It also depends on how the patient views the doctor. Most patients are there on the receiving end. They wouldn't dare ask questions. So what do you expect? You can't expect the professional to actually bridge the gap. I think it has to come from the patient.
Yes.
But it's doable. It can be done.
I will just add some literature review that we have made. And for example, the selection criteria for patients' partners in the literature, they are three types because of his pathology, for the personality of the patient, and for their training in pedagogy and other criteria. For example, the origin of patient partners also, the literature says three aspects. Is a patient base, from patient association, or personal or professional knowledge. And also, just to add some literature review, because this is quite interesting to discuss this, the evaluations of teacher patients for the literature is stratified into 4 levels. Use patient-derived data, including videos, integrate the patient informally without supervision, work with patients trained in teaching, and co-constructing lessons with patients. So this is a huge and holistic view for the participation of the patient teacher in academy, in science, because we have the experience in cardiology and precision medicine to bring some patient teachers to these health professionals, as Tamara Milagre, as Alexandre Guedes, and the results were very good because they have the profile, they are representative, and they had they have training in pedagogy, and to have training in pedagogy for me is quite important for the profiles. Of course, patient advocates are the summarize every position. So thank you, Ruth, for your reflection. And I will start the second question, that is join the 2 questions, that is for Tamara. Which are the main goals to implement the patient teaching, facilitators and barriers, but which content patients could bring to education? Tamara, please.
Yeah, I think that the main goal is actually that we need to develop a structured partnership between patients and medical teaching entities. We need to implement it into the system. I know that the medical teachers, professors at the university, they are not against involving patients into the teaching program. They just don't know how to approach whom. Again, I said this in the beginning. So the main objective is maybe to structure the way we can do it, so everybody can take advantage of the program that is structured by co-created also with patients and medical teachers. So I think the nurturing the pedagogical dynamic in the training of future healthcare professionals is also very important. I think a facilitator is that there's also already existing robust scientific literature that advocates and supports the development of patients as teachers, as well the institutional recognition and recommendations from organizations that patient teacher is a valuable figure in the teaching process. There should be working groups working on that, but the main barrier, I think, is the lack of knowledge about what patient partnership is doing. What does it mean? Yeah, there's a difficulty in selecting the right patient. As you said, there are different categories of patients. You also need something that is able to capture attention. You need training in speech. It's not only the pedagogical way how to teach what, it's also the way how you give the word to your audience that is very important. I can tell you from my own experience that the lessons with patients were almost always the very best rated lessons at university, because if you bring the real life of those people you are going to treat in the future inside the classroom, the empathy is starting to grow, you know. I remember many times I'm a nurse by training, I worked at the maternity, and I saw a lot of doctors doing delivery in a very different way after they gave birth by themselves, you know. They were completely different in doing that. So empathy factor is very important, and bringing in the patient's story inside the classroom is going to grow empathy in future healthcare professionals. I think that's a very important point.
Thank you. Thank you very much. Alexandra, and what about facilitators and barriers and the contents that patient could bring to education? You are without sound? Okay.
I'm now with the mic. That's a challenging question. First of all, I think what patients can give, and the questions they would bring to the table are quite different from the ones that you normally expect in academic setting, which means that for most of us, what is important is that the disease doesn't interfere too much with our normal routines. So we want to keep living as we were prior of the situation, and that is quite different from the perspective of the practitioners or from the doctors, from the nurses, who normally try to create or change our habits in order to get some health gains, and that creates a very important conflict in the self, which means that many of the patients they don't want to see his life or her life disrupt with a very aggressive intervention that put them in a hospital bed for a long time with all the consequences of an intervention like that one. And in many cases, for elder people, they lose completely the muscles, and they become seated in a wheelchair or in a bed. So, for most people, what they really want is to have an intervention that provide them quality of life till the end. And that is quite different from what is the normal practice. The normal practice is let's save the guy, regardless of the final outcome of that intervention. And I think this is something that we need to put in the discussion. We need to discuss more these ethical and personal aspects, and the patients can bring to discussion these questions, namely in the area of palliative care, because it's one of the forgotten areas of medicine.
And you have right. Ethical questions in patients' teachers would bring some reflections. What will be the line to stop? What will be the line to show our life and our disease to others? So it's quite interesting. So, do you think that in this case, which will be the content for this could bring for the education? And what will be the facilitators to spread this opportunity of patient teachers in education?
Again, the facilitators are.
You didn't finish. I was passing to Gertrude.
Okay. Sorry. I thought it was me.
Because
please, Gertrude.
So we have
enter.
A large group, short time, 3 minutes. Gertrude, please.
Yes, I think training is very, very important. Because sometimes patients, they have the experience of the illness and of the dealing with the condition, but maybe they do not feel empowered enough or confident enough to speak up to the professionals. As Vivian shared, when the nursing department approached us to recommend a number of patients to meet with the nursing students and be patient teachers, we only had 2 or 3 patients who put their name forward. When in a survey we did, we represent 12,000 families. Where are the others? So we really need to show the patients and encourage the patients that you do not need a university degree to be a patient teacher, but probably we need to give some skills like public speaking and also how you share your story, because sometimes people are stuck to their own experience of the condition, when we know that there may be people who have different experiences, though they have the same label.
Yes, yes, of course, of course. And encourage the patient to be a patient teacher and training the patient teacher. We have some leaders of the patient organization, as Tamara, Alexandra, and Gertrude, and probably Dr. Maria Teresa Flor Lima also, but we have more patient that could be the profile of patient teacher, but they must be trained. I agree absolutely in the communication, speech, the story, not only his experience, but experience as a patient, and to turn to knowledge to this academic and science. Even we're talking not only in medicine, but in nursing, psychology, clinical trials. This is quite good, and I see Joaquim Brites. Hello, Dr. Joaquim Brites, so good, APN, neuromuscular. E a doutora Ana Clara da Silva Mendonça. Como está, doutora Ana Clara? Como está? Well, let's go to the Maria Teresa Flor de Lima. Please, doutora Maria Teresa, which are the main goals to implement the patient teachers, facilitators, and barriers, please? 3 minutes.
I agree with the new topics here as preparing the patient teachers. The goals are very important to organize the health politics. It's very important to hear the needs of patients because they know better how to communicate so spontaneously their problems. I think it's impossible to do politics inside without patients, only the politicians working together, and that is not important. So the objectives are to compare also examples from some pathologies from country to country, and to empower also the patients with skills and abilities to help them to overcome the crisis they have. I think we must be to have attention to the problems of the disease, because some are cyclists. Sometimes they are well, sometimes they are not well. So we need to know why some patients are in crisis. So it's very important to the professionals to be prepared also to look at this topic. I think with these teachers, we can stimulate research, advocacy, humanism, and volunteering also. I think we need to reduce costs in health, because if patients are prepared, if the politicians are correct, we can have a better quality of life and better treatment. So these are the best objectives. I want to go back if you let me to talk about barriers. The barriers, I think there is paternalism in some classes of healthcare professionals. Uh, so there is a very good relationship between patients and professionals. Lack of training in literacy in some topics for professionals and for patients also. Some communication, empathy, counseling is very important. This makes a better communication and a better self self control of the
Yes.
of
Thank you. We will find another round. Thank you. So, Carmen, please, could you bring some ideas to these questions?
Well, I agree with all of you. Definitely, we need training, but I have seen many patients, advocates, especially the young people. And I think something very important that nobody talks about is emotional healing before talking about your experience or about talking the experience of others. Because if you are not in the right stage where you can share your experience in a quiet way, like I think it's even more difficult for the researchers and for the other public to understand what was your experience. So first thing is emotional healing and also support from the organizations to support patient organizations and patients to let them share and also be credited by this experience that they have, because this could be maybe in a monetary way, but also maybe like putting them as authors on the research or giving them like a value of sharing their experience.
Thank you. Thank you. Thank you, Carmen. And Vivian Cassar, finally.
Yes, I don't have that much to add because everybody knows it. But I think it's very important for the professions to know what kind of language to use, because I've heard, people sort of say, because the doctor says, "Oh, why are you making a fuss?" And it's something small. But for a patient who is in an emotionally vulnerable state, even something small can be very, big. So, so the choice of language that professionals use, they can say the same thing, but if they choose the right wording. Now, I'm going to take another aspect. From the professional side, are the professionals aware of their state, their emotional state and their psychology? As a counselor, this is important to me as well, because when professionals are going and meeting lots of distressful situations, what is their emotional, because Carmen was saying about the emotions, what is their emotional state? Are they aware that they need to be to have professional kind of help as well when they're going through? Are they ready to ask for help for themselves when they're going through distressful situations with patients? I think that's an important factor. I don't know if it comes into this argument as that, but I think it is a bit of a facilitator, because if the professional is not in a good emotional state, then they will do more harm to themselves and to the patient as well. Maybe. Okay, that's all I have to add, because I agree with everybody else, about training, etc.
Yes. Thank you, Vivian. So good. We find here so many ideas. We have 1 hour already almost to finish this webinar, this first webinar. So the last round will be to each of you 1 minute more or less. So what will be the next steps for this profile of patient teacher? You talk about training the patient teacher, training with some communication skills, public speech, pedagogic, to have the profile of empathic. The ethics must be present, not only the biomedical model, but psycho model, to have the all vision, an holistic vision, to bring new ideas and sources for the academic and science. And this holistic vision, so what will be the next steps? To organize a profile, to write an article. Gertrude, I will begin with you. What will be the next steps?
I think seeing who would be willing to take this step as a patient teacher, because it is very important that the person is ready to take the step. Because like Carmen said, if the person is not ready, is still dealing with the distress of the condition, it might not be so good for the person, and also for the proposal. So we really need to see who is ready to do this.
Thank you very much. To be prepared to give these steps is quite a very good idea. So, Alexandre, what do you think? What will be the next steps? Clearly, in 1 minute.
Next steps. I believe that we need to start. And starting means that we need to look at what are the most vocal and most influent patient advocates and start with them. And the profile would be something that would be tuned by experience during the time, because you cannot discard nobody at start or create a very rigid profile. I think it's necessary to present different views, and if you format too much, you can incur in a single format, in a single view of the patient.
Correct.
So I believe that the person should be aware of the 3 dimensions, the bio, psycho, and social dimension of the problematic, and I believe he should be an active patient advocate. And if he lives with the disease, is normally stronger. Would be a stronger player than a person who don't live with the disease. So I would say that you need to open room for volunteers as room for staff that works in our patient associations.
Yes, and I will add that we must prepare also the schools. The schools must be prepared to receive the patient teacher, because they are not prepared for this. And this partnership must be open doors in the schools, in the academia, in the universities, to have this whole perspective of the patient teacher, besides all you have said that is quite important to the profiles. So, Doutora Teresa Flor de Lima, what will be the next steps? 1 minute.
I put here in the chat what I think which is the profile of a patient teacher. Besides that, to start, I think this group must start with these patient teachers. I agree with Alexandre with saying that we must choose in our associations the most dedicated patients, the most able to do these, to show these diseases, because some people is not able to talk about themselves. The psychological problem is very important. The emotional also. We see that in pain patients, where today in all over the world, the definition of chronic pain changed, because it was need to join these emotional problems, to pain and to the way of life. I think we must take attention.
Thank you very much. Thank you very much. Vivian, can you add next steps?
Yes, I was thinking, should patient groups approach the faculties of health, within the university, to sort of discuss these things with the faculty coordinators, etc., and offer that this can take place. I think that could be a good step to start where it has not already been done, obviously. That's my main thing.
We have some universities that we are used to bring some patients and patient advocates, but it's not common. It's not common. It's sporadic. It's punctual. But we need to have this academic vision.
Yes. So by approaching the faculty coordinators, they can put it into the curriculum, sort of, the slots into the teaching program. Yeah.
Of course, I agree. So, Carmen, dear Carmen, what will be the next steps? And for young students, what do you think that will be useful?
Well, I think the first thing is to talk about this, about patient teacher, what is it? And even though like these days, I don't think that there is a common term or common conditions for patient advocates. So I think that is a lot of information that we have to give others about this topic. And also, as Alexander said, open the room for different patients, like diversify the scenario. Because if you look for the most famous patient advocates, all of them have some certain characteristics that maybe they are not representing the whole population. So having diversity on the voices of patients, it will be very useful for the future.
Yes, thank you very much, Carmen. And finally, we will finish with the voice of Tamara. Please, Tamara.
So as Vivian said, that was actually my first point. A proactive approach of the universities would be a very immediate and practical step to get things done. But then we need to structure this better, and we have to establish partnerships with faculty and patient organizations, mainly umbrella organizations that represent several disease areas. We have to create a common platform, where a matchmaking platform where faculty can find patient teacher that fits for the topic they are looking for. There are different profiles of patient teachers. It's as simple as the personal testimony and goes up to patient advocacy, to patient expert that have a very deep knowledge of several topics. So there are different profiles, and you can do a matchmaking platform, and everybody knows where to look up and how to find the partner you are looking for. I think that would be a great practical idea.
Yes, such wonderful thoughts, common thoughts with this first webinar. This is the first event in Portugal for patient teacher. And I thank to Malta Health Network also for the association with this event. Thank you all. I don't know if someone wants to share some idea, please. We have some more minutes, 1 or 2, but I see Ana Clara Silva that is representing the generation, the elderly in Madeira, and she's responsible for several projects. Dr. Ana Clara, do you think that we can integrate in your project some patient teachers in the near?
Thank you for giving me the word. I'm in Madrid at the moment, and it's a hopeful climate here. But I will be very short. Thank you for this beautiful and fruitful webinar. I'm sharing in the chat that the project, as I shared with you, Christina, in the past, Madeira, Açores, and Canarias, but Canarias and Madeira, we are preparing for a next call in September to launch a project that means a passion school, a digital passion school for all Macaronesian region. That means Madeira, Açores, Canarias, and one country in the Middle Atlantic. Of course, it will be Cape Verde. And for that, your capital and intellectual support, it will be very, very, very important. And of course, for Doutora Maria Teresa Flor de Lima could be our lança in Açores, because in the first call, the government, it was in a special situation with the budgets and program of govern, and he couldn't participate. Now it will be very important that we have all the three regions doing this project. In the first time could be just thinking about the architecture and the themes and the methodology, but it will be very important to have your support. And of course, Christina, it will be very important on this project. We hope to be successful on that. Thank you.
Thank you very much, Dr. Ana Clara. It's very good to be here and to see you here participating. We see several experts and president of patient associations, but we don't have more time. This is the first episode starting with the patient teachers. We will have more. Thank you all for being here, and thank you for the speakers because they are great. Thank you, Dr. Maria Teresa Flor de Lima, for such an inspired me some years ago, starting with pain, but with several ideas that we come together. Tamara Milagre, president of Evita, such a huge human woman, so resilient and so determined in everything that she makes. Alexandra is a fighter and a well-known responsible in Portugal that brings so much ideas. Gertrude, so pleased to know you and your force and organization with more than 40 organizations will be a very good partnership to Portugal, I'm sure. And Carmen Monge, you are such a good representative of the youth, and we need so much the voice of the youth. Congratulations for your life and for Cancan and for everything that you've done. And finally, Vivian Cassar, thank you very much for your vision, your ideas, and your patient advocate. And thank you all. We will see next episode as soon as possible. Thank you. And thank you to Vania Lima, our communication director, that is always present. Thank you. Bye-bye.
Obrigado.
Bye. Thank you.